Align the nail with the insertion handle, match on the insertion handle to the notch. Use the cannulated shaft, hex 8 mm to thread the cannulated nail connecting screw into the nail. Tighten with self-retaining screwdriver, star head T25 making the Tarsus nail assembly. With the patient positioned in the prone position, and utilizing the C-arm, we place the radiographic ruler parallel to the tibia and mark the skin according to the length and diameter. Assemble the 13/3.2 mm trocar with the 13 mm protection sleeve and advance this assembly through the incision to the calcaneus bone. Insert the 3.2 mm threaded guide wire through the trocar toward the center of the talus dome. Confirm guide wire placement with fluoroscopy. Remove the trocar from the protection sleeve. Place the 13 mm cannulated entry reamer over the guide wire and through the protection sleeve into the bone. Drill through the calcaneus and talus until the opening drill exits the talus. Remove the 3.2 mm guide wire. Insert the 5 mm 3-fluted drill bit through the canal, center the drill point under the tibial canal in both the AP and lateral planes. Insert the guide wire with ball tip through the opening into the medullary canal of the tibia. Advance the reamer steadily without forcing it. Remove the reamer and guide wire. Insert the nail assembly, advancing it until flush with the calcaneal opening. Thread the driving cap to the handle and lightly use sliding hammer blows to seat the nail. Confirm anatomical alignment, then remove the driving cap. Advance the aiming arm on to the nail assembly. Attach the aiming arm to the insertion handle with P visible. Thread the alignment pin into the aiming arm. Tighten the threaded alignment pin. Assemble the 15/13 mm protection sleeve coated with D and guide wire sleeve D, inserting it into the aiming arm. Make a posterior incision and advance the sleeve to the bone. Insert the 3.2 mm guide wire with threaded tip into the calcaneus until flush with the anterior cortex. Confirm wire position radiographically to determine the spiral blade position. Place the measuring device over the guide wire and advance it to the bone. Read the measurement at the guide wire end to determine the spiral blade length and remove the measuring device. Make an incision to split the Achilles tendon before inserting the spiral blade, to prevent damage to the soft tissue and risk of necrosis. Insert the cannulated drill bit over the guide wire and through the protection sleeve to perforate the posterior cortex. Remove the drill bit and protection sleeve, leaving the guide wire in place and attach the aiming arm adapter. Attach the appropriate length spiral blade to the spiral blade inserter using the connecting screw. Advance the spiral blade inserter through the aiming arm adapter, ensuring engagement of the inserter's helical grooves with the mating pins of the aiming arm adapter. Manually advance the spiral blade to the bone. Use light, controlled blows of the slide/fixed hammer in a fixed position to seat the spiral blade. Advancement should be monitored radiographically. The correct insertion depth is reached when the spiral blade head is flush with the posterior cortex. Follow the same procedure with protection sleeve C and guide wire sleeve to insert the second distal locking screw from locking hole. Instead of using spiral blade and locking screw, we can use two locking screws of 6 mm at distal end. Rotate the aiming arm to show T on the handle, and retighten the alignment pin. Insert the 3-part trocar assembly B through a stab incision to the bone and remove the trocar B. Drill with the 4.2 mm drill bit to the anterior talus, confirming position radiographically. Press the drill sleeve firmly to the bone and measure the locking screw length from the drill bit. Remove the drill bit. Insert depth gauge measuring up to 100 mm into the protection sleeve and advance the knob of the depth gauge into canal until the gauge hook grips the opposite cortex, confirming with imaging. Read the locking screw length from the depth gauge. Insert the locking screw through the protection sleeve using the star drive screwdriver, T25. To achieve compression in talocalcaneal joint, use sliding hammer. Aligning aiming arm so that M is visible on the handle, and tighten the alignment pin. Insert the 3-part trocar assembly, B, through the aiming arm and stab incision to the bone. Remove the trocar and drill through both cortices using the 4.2 mm calibrated drill bit, stopping immediately after penetrating the far cortex. Choose the screw position based on the requirement, the static hole for stability or the dynamic slot for controlled dynamization of the bone fragments. Insert the locking screw through the protection sleeve using the star drive screwdriver. To achieve desired compression, use the sliding hammer. Repeat the procedure for a second proximal locking screw. After fixations of both the proximal locking screws, disengage the insertion handle from nail by unthreading the connecting screw from the assembly. Insert the golden end cap with self-retaining screwdriver shaft, star head T25. If we are using locking screw instead of spiral blade, we use blue end cap with the star drive screwdriver.
Auxein